Good afternoon, class. This is Mr. Silwamba. Today I want to look at colostomy care. So colostomy care, there are two different types of colostomies and the way we care about those. So the first one I want to do is a colostomy which is not yet discharging fecal matter or effluent. And then secondly, we'll do colostomy care where there is effluent. So where there is effluent or fecal matter, it means that it's a clean procedure. But a colostomy which is not discharging yet, we're going to treat it as a sterile procedure. So that's the one we're starting with. So let's begin as usual. So you do the post and washing because you're supposed to be fast. Okay. Then you dry your hands. So good morning, Mr. Mlenga. I'm student number 2 from Kalurushi College of Nursing. I've been assigned to do colostomy care on you. May I please go ahead? Okay. So before I begin, anything I can do for you? Okay, nothing. So I'll just peep. What about you? You're sleeping? How is it? Okay, it's okay. So at this moment, I have to wear gloves. So, but before I wear gloves, there's a fluid to pour. So as usual, you need to pour the fluid there in the galley pot. So this is cool boiled water. So you go around and pour the fluid. Okay, so that's cool boiled water. So this is for cleaning the colostomy. Then at this moment I can wear gloves. So these are just examination gloves. I've got them from the bottom shelf. Okay. So at this moment I want to just see the bag itself. So you need to expose him, Mr. Mlenga. I'm just checking the bag. So this is the colostomy bag, and then you can loosen it because it comes with, but this is not the real one. The real one is adhesive to the skin, so you need to just loosen it. Loosen it so that you come and remove it as you start cleaning. Then you can also put the incontinence sheet because it's loose in case fecal matter was to come out. So you need to put incontinence sheet. So it's this side, so you can put incontinence sheet this side. Okay, so just you can lift him a little bit so that you put it under. Okay, so at this moment you have to just go and scrub. So you ask your assistant to expose him when you come back. So let me just cover. So scrubbing as usual, you need to go that one, then you go this way too. Okay, then you can do that up to your elbows. Scrub up to your elbows, then go. Okay, so after that, you can dry your hands. So you start with the fingertips, then in between your fingers, up to there. This is where it ends. Then this other part, you go fingertips again, in between the fingers, then you go in a circular motion up to the elbow. Third corner, you start from the fingertips again, then in between, then up to there. Then fourth corner, you go behind your palm, fingertips, in between, then you go round. So after you do that, you fold it and throw in that basin. Then you can don gloves. So how you don? You hold here, don't hold this part as usual. So you hold there, then slide in your fingers. Okay, so at this moment you can also pick this side. If you're not correctly done this side, you can just pick and go ahead. Okay. So you can do that. And this side now you can put it correctly. Okay. So once you do that, you can now prepare the swabs. So you can prepare just about 5 swabs. So that's 1, 2, then 3, 4, 5, then 6. So at least you can go 5 to 6 swabs, it's okay. Then at this moment, you can ask your assistant. My assistant just kindly pull from that side, put the bedsheet, pull out the bedsheet. So you have exposed now the patient this side, so you're able to see the colostomy bag. So what you do, you pick one of the forceps. When you pick one of the forceps, you have to remove the bag since it was loosened before you started. So you pick, then you discard it there and discard the forceps. Okay. So after that, you now have to get the drape from here. You spread it, then you go the whole drape like that from that side, then you come this way. So since it's this part we are cleaning, this colostomy, so you need to ensure that it's exposed. So after that, now you can clean. So if you're dealing with a colostomy which is sterile, you start from the middle because there is no fecal matter coming out yet. So you do that, then start from the middle, not outside. So sterile colostomy from the middle. So you start like that in a circular motion. Then you discard another swab. Then where you ended, circular motion from the middle part, you go, you throw. Then another, now you move from the middle, you move outside. So you can go now outside the colostomy, there, halfway, you throw. Another swab. Then where you ended, you can continue, or this side, you remove. So you can do it as many times as possible as long as it's clean. So at this moment, it's now been cleaned. So you can prepare a gauze. So because when you prepare gauze, you just want to put there because you'll be able to put Vaseline gauze. Vaseline gauze, the colostomy bag won't be adhesive to Vaseline gauze. So you need to prepare gauze like this and put it there. My assistant kindly give me Vaseline gauze. So as my assistant gets Vaseline gauze, you need to get it with a faucet. Just pick one. Okay. So just pick one. So when you pick one, you can make it like this. You can roll and put it round the colostomy. So when you put it round the colostomy like this, meaning that you're preventing the skin from injury or excoriation. It won't be injured, or you prevent bruises or excoriation. So to prevent now the bag not adhering, you need to put dry gauze on top, like that. When you put it like that, meaning now you can put the bag. My assistant may have the bag. So it comes in a plastic. So at this moment, the assistant can open up for you and give it to you. But then this is not the real one. So we're just demonstrating. So the real one comes in a plastic. So you should be able to open, then I pick it. So let's just assume that I've picked it and it's a real one. So you have to just get there, remove there's a paper which comes with it, remove it, and then stick it there on top. So meaning that you have put the bag there and you have done the cleaning. So this is what we call colostomy care. So this is a sterile procedure because there was no fecal matter coming. So at this moment, you can even thank Mr. Mulenga. Thank you very much, Mr. Mulenga, for allowing me to do this procedure. So this bag I've put, it will start collecting fecal matter. So when it's halfway full, ensure that you call upon the nurses to change it, because if it's too full, it will make the area dirty and then the skin will be damaged. So thank you very much for allowing me. So you can even cover the patient and go to the in-charge. So you can tell the in-charge that the in-charge have done colostomy care and left Mr. Mulenga comfortable and have documented. So the last part that you're going to do is you're going to wash hands. Just the hose type. Okay. And use your hand towel to dry. You can dry using your hand towel. Okay. So thank you for watching and ensure that you practice so that you make it easy for yourself. Thank you.